The land that we are meeting on today, the Warramai and the Wabakal people from where I come from in Lake Macquarie, pay my respects to their elders past and present, and just acknowledge that this land wasn't ceded or given away or sold, it was taken without permission. Thank you all so much for coming today. This is a really important fight for us. Let's be clear, if you are going to need a blood test, a urine test, a faeces test, an X-ray or a pap smear, then you are directly affected by this policy decision. Just last week, I had to have the beautiful experience of the pap smear. For those of you who've not enjoyed that experience, it's when you have that opportunity to feel the wafting breeze of the air conditioning unit from the doctor's offices up your private parts. It's quite an experience. I put that experience off as long as I possibly can. I also don't have that much disposable income. So when pathology services funding is cut, of course those providers are going to pass those cuts on to the patient. And that's an added disincentive for some people, like me, like many people, to have what could possibly be a life-saving screening process delivered to them. So what we were seeing from these cuts is really the Liberal Party philosophy in action, a belief in the free market, a belief that the individual should bear the cost burden of essential services in their lives. As Jacinta said, the AMA has said that this is the doctor's co-payment by stealth. We fought that one off. We need to fight this one off as well. We need to say no to these cuts. We're a wealthy country. We can afford a proper health system, one that includes these services. It shouldn't depend on income. It shouldn't depend if you're living in a remote area, and it shouldn't depend if you have a vagina. The thing is with health, it is not a commodity. It's a human right. We all know that early detection is essential for the successful treatment of disease. Making pathology services more difficult to access will mean that people can't access those services, that their disease is undetected, and they will die. The slogan for this campaign is true. These cuts can kill us. This foolish decision is opposed by the Greens. The Greens believe that rather than cutting investment in health services, we should be increasing that investment. Our health system should include screening processes. It should include pathology. It should include things like adequate care for mental health issues, for palliative care, for all sorts of health issues. And in the coming weeks, you'll hear more from Greens leader Richard Di Natale as he continues his roundtable discussions with health stakeholders and law enforcement representatives, calling for a discussion on illicit drug use and to discuss the need for addiction to be included as a health issue. Yes. So our health is not a commodity. Our health is a human right. We need to let this government know that. They need to hear the community loud and clear saying no more cuts to our health system. Thank you for coming.